So hello guys, we have to start the stomach anatomy. So basically first stomach some important points. Stomach size. So in adult it is around 1.5 to 200 ml stomach size. इसकी position, now its position. So first it is like this is one end and this is big fundus region, and now this is dome. Hmm. So this is stomach. So this is cardiac end and this is pyloric end. Then it is present around the point of intersection between transtubercular plane and midsternal plane, slightly 1.5 centimeter to right, 1.5 centimeter right to intersection section point of transtubercular plane and midsternal plane. Midsternal plane. Then this cardiac end is left to left 2.5 centimeter to midsternal plane at seventh costal cartilage. Seventh costal cartilage. So this is dimension of stomach. These points. This fundus region, it is at around this fundus present at it reaches to fifth costal space. Fifth costal space. Fifth costal space. So this is the position of the stomach in human. It is present in first in segments. It is present around. It is sometimes horizontal or sometimes oblique. Present oblique position or also horizontal. Also horizontal. Then which segments? It is present in left hypochondral and epigastric segments. Then when it is present horizontally. Now parts of the stomach. So this is the some basic ideas, basic points. Adult adult volume position, sectors, point 2.5 centimeter left to midsternal, this cardiac end, this pyloric end 1.5 centimeter right to intersection of tubercular and midsternal plane. Fundus region is reaches to fifth costal space. Now the parts of the stomach. So this is stomach. First, it is divided into four segments. This region is called fundus. This neck region around this is called cardiac, and here this point is called angular angle of incisura. Incisura. Here is incisura angularis. This point, and here this this is called body of the stomach. Then then and this is body, and this is pyloric region. It is divided into three segments. First, this is pyloric antrum. Then this is pyloric canal, and the last this region. This is called pylorus. These are the three segments: one, two, and three. Done. Now this is the point where constriction present. Sphincter, just a gate which control the opening of and closing of stomach, entry of food into from stomach to duodenum. Control. Here is true sphincter present. True sphincter. True sphincter present, which control the opening and closing. There is one sphincter also present here. This region. One sphincter also present here, but it is not true sphincter. Sphincter also present, but not true. It is physiological stomach sphincter. Physiological sphincter. And this is anatomical sphincter. Well, sphincter. Done. So these are the two sphincter parts of the stomach and some labeling. Now, fundus, it is present just near to five intercostal space, just up below. Above, there is a diaphragm present. So it is a portion which contain gas. Some gas present here, which is look as radio opaque in radiogram. Radio opaque. Done. One point, and another point is stomach gastric glands also present here. Gastric glands also present here, like chief cells, peptic cells, and oxytocic cells, all cells present here. Then one glands also present, some types of gland present here, and some glands also present here. Pylorus region. This is called angular in the service. ठीक है? या फिर एंगल, इसको ये बोल सकते हैं angularis. Angularis. Then these are the both common name. Then both are same. Now here is a canal also present. A canal also present, which is like this. Then this is called gastric canal. This is called gastric canal. It is a alternate passage for all water liquid things. A passage, a bypass passage. A bypass passage for liquids. They directly go from stomach to duodenum from this passage, not enter into stomach body. So this is important bypass passage. And this is the most common site for ulceration also. A, a common site for ulceration. Common site for ulceration. Common site for ulcer. Then this is clinical point. Clinical. Reason for this point is because it is very thin. It is very thin. No reason, no oblique layer present here. Oblique layer present here. कोई भी oblique layer present नहीं होती. What is oblique layer? It is a histological part. There are 4 layers, 5 layers in stomach. Extra layer is oblique layer, which is not present everywhere. So this is the total section. This is the total part we have covered about stomach. Then adult volume, oblique position, left gastric, left side. One point is left side, another point is the right side. Its parts, sections, body, clinical, and etc. Now come to the another section. Then the body of stomach contains some gastric folds. Body mucosal folds contains some gastric mucosal folds called rugae, which is important. Rugae. This rugae does not present fundus region, and sometimes this rugae may be absent in body also, according to the condition of the stomach. If for some foods present in stomach, so there is no rugae present in this region. But if stomach is empty, so rugae present. Then first now histology of the stomach. Histology. So there are many layers in stomach. All GIT, there are four layers. In all GIT, there are four layers present in whole GIT. Outer, inner, and then inner again. Then one is outer layer, which is called serosa. Then in esophagus, it is also called adventitia. Then because there is no peritoneum present. If peritoneum present, it is called serosa. If not, then it is called adventitia. Serosa if peritoneum present. Okay. If peritoneum not present, called adventitia. In stomach, it is called serosa. Simple. Then another layer is inside this, which is called muscular externa. It contains many layers of muscles. Two layers basically. One and another one. Like this. Muscles present here. And another layer of muscle also present. After this is these two called muscularis externa. Muscularis externa. We go from outside to inside. Muscularis externa. Two layers. Again, outer longitudinal muscles and inner A and B. Inner circular muscles. Done. So these are two layers. Of in between two layers, there is a One important plexus also present, which is called enteric nervous system between two layers, which is called enteric nervous system, orobac plexus and Meissner plexus, then which controls some important things. After this, there is another muscular layer present, which is called oblique layer, which is only present in stomach. This is important layer. One, two, oblique layer. Important marking of stomach. Only present in stomach. Present in stomach. Then this layer is not present in everywhere. Only in stomach. After this, there is another layer, which is called submucosa, and then finally mucosa. This submucosa, and then mucosa, which is innermost, which contains some gastric fold, which is called rugae. This is mucosa. Done. So first layer, so this is first layer, second, third, fourth, and then fifth. So these are the histological layers of the stomach. After this exposition, then we come to their important point, nerve supply and all, blood supply, nerve supply. Before this, we revise previous. These are the important markings of stomach we have covered. Done. And so we have covered these things all: stomach orientation, stomach supply, stomach parts. So we have covered this: stomach, gastric canal, all things, and histology. Now we will cover the blood supply of the stomach. Blood supply. Blood supply. So this stomach wholly supplied by the some branches of the aorta, like celiac trunk, almost celiac. This is completely supplied by celiac trunk. So we have almost covered the celiac trunk already. So first we draw the stomach. Arterial supply. First we cover the arterial supply. Arterial supply. Then this is arterial. Then venous. Then other thing. Wait. This is draw here. So this is stomach. First, we know there is a trunk called celiac trunk. Let's say this is celiac trunk from aorta. It is at which level? This is celiac trunk. Done. Celiac trunk at L1 level. Upper L1. Upper border of L1. This is at upper border of L1. It gives a branch, first branch, which is called left gastric artery. It go upward and then come downward like this and cover the lesser curvature of the stomach. This is called lesser curvature. This whole is lesser curvature. It gives some esophageal branches also. Then, so this is left gastric artery. Now another artery of this is, we know, splenic artery. Splenic artery is the biggest artery which go behind the stomach to the spleen. Then it gives some branches called to the fundus of the stomach, which is called short gastric arteries. These are called short gastric arteries. Gastric arteries. And another branch which is given by this is left gastric epiploid. This is left gastric epiploid artery, which is given by splenic artery, which cover the greater curvature of the stomach from the left side. This is left gastric epiploid artery. Then this is first branch of celiac trunk. This is first branch. This is second branch, which is called splenic artery. This is splenic artery. Done. Now another branch of this is common hepatic artery, which go towards the liver. It divides into two. One is gastroduodenal artery, another is hepatic artery proper. These are two arteries. We give them names. This is common hepatic artery. This is common hepatic artery. Divided into two branches. This is hepatic artery proper, artery proper, and another is gastroduodenal artery. Duodenal artery. Then these are two branches of the artery, common hepatic artery, which is a branch of celiac trunk, which is arrives at lower border of L1 level. Then, so here Hmm. Now, this is gastroduodenal artery. It descends, it descends like this and give a branch to cover the greater curvature of the stomach. This is left gastric epiploic artery, so this is right gastric epiploic artery. Right gastric epiploic artery. Epiploic artery. Done. So these two arteries cover the greater curvature of the stomach. Now another is hepatic artery. Hepatic artery proper. It gives a one branch which cover the remaining lesser curvature of the stomach from the right side. This is called right gastric artery. Simple, like this. This is left, this is right. This is called right gastric artery. Done. So these are the some important four arteries which cover the stomach from the greater curvature and lesser curvature from both sides. One, two, three, uh, and fourth. Fourth is left gastric artery. This left gastric artery namely. This is this left gastric epiplug. This is left gastric artery. One is mm, left gastric artery. Left gastric artery. These four arteries are very important, which is are branches of the some part celiac trunks. Basically, first branch is celiac trunk, left gastric artery, which cover the lesser curvature from the left side and descend down, which both sides. This gives some armpit branches from both sides, anterior side and posterior side, all both sided. Now, another branch is splenic artery, which go from behind the stomach and gives some short gastric arteries which supply the fundus of the stomach. It supply the fundus of the stomach. And one branch is left gastric epiploic artery, which cover the greater curvature of the stomach. Then another artery is common hepatic artery, which divided into two: gastroduodenal artery and hepatic artery proper. Hepatic artery proper give a branch from the right side, gives the right gastric artery, which cover the remaining lesser curvature, and one gastroduodenal artery gives branch which cover the greater curvature called right gastric epiploic artery. Done. These are some arteries. These short arteries are called esophageal branches, which supply the lower part of esophagus. Esophageal branches for lower part of the esophagus. Done. So this is the arterial supply of the stomach, whole arterial supply. Now come to the venous supply of the stomach. Venous supply of stomach. This is most similar to the arterial supply. Just important point is portal vein, which supply them the stomach. Then first we draw the stomach. Then this is stomach. First, we know there is a vein formed behind the neck of the pancreas. Here there is pancreas present, pancreas neck. This is pancreas portion below. It is behind the stomach. That we have already talked about this. Behind the neck of the pancreas. This is around the behind the neck. There is a vein formed called the portal vein. Portal vein. Portal vein behind. From downward, there is a vein come which meet, and from the splenic side there is also another vein behind the spleen which come and join with this. This is this hole is behind the stomach, behind the pancreas neck. These vein dip ascends upward. Done. And here we know there is a pyloric region called pyloric sphincter present this region. Done. These vein ascend upward from behind like this and give branches similar to the artery, left gastric artery and the right gastric artery. But important point is both are given by this vein is called which is called portal vein. This is superior mesenteric vein. This is superior mesenteric vein. From here there is inferior mesenteric vein also come. This is inferior mesenteric vein. This is inferior mesenteric vein. Mesenteric vein. Then these both vein. This is and this is splenic vein. These these both combine. These both combine and this splenic vein combine with inferior mesenteric vein and then join with superior mesenteric vein and this form the portal vein. This is called portal vein. Portal circulation. Portal vein. Now there is a connection between superior mesenteric vein and the right gastric vein, which is called important vein, which is present near the pylorus region, sphincter region, basically above the sphincter, which is called pre-pyloric vein of mu. There is a huge vein like this. This present near this region, and then join with superior mesenteric vein. This is pre-pyloric vein of mu. Done. So from lesser curvature, these cover the left gastric vein and the right gastric vein. Similar to the arterial circulation, left gastric vein, another gives esophageal branches. That in right side, We know splenic vein gives the similar branches, which is called from splenic vein, which is called the left gastric epiploid, which join with the splenic vein. These are the tributaries. This is the left gastric epiploid vein. And here important point is superior mesenteric vein give the right gastric epiploid vein. And then these join splenic vein and then supply the portal vein. Here is superior mesenteric vein gives the branch, superior mesenteric vein join, which gives the left right gastric epiploid vein, which drain into superior mesenteric vein. Basically, these are the tributaries. Veins collect the blood from the circulation and then drain into the heart. So these are the tributaries which drain into splenic vein, and one is drain into superior mesenteric vein. Then these drain into portal vein. Circulation is like this, like this. This is circulation. Remember, from above this direction, this is direction of blood flow. Done. This is branch of, so this is tributary of superior mesenteric vein, which is called right gastric epiploid vein. These left gastric, this left gastric vein and splenic vein also give here some fundus branch, some short gastric arteries, short gastric veins similar to arteries. Some short gastric veins also come from the fundus region and then drain into splenic vein. These are called, which supply basically drain from the fundus region. These are called short gastric veins. Done. Then this is right gastric vein. These both are the tributaries of portal vein. And this is left gastric vein. Gastric vein. So these are the important veins for the stomach drainage. Done. And these are the tributaries. Simpler, just simpler, similar to arterial circulation. Splenic vein, splenic circulation. This splenic circulation is important. Basically, this splenic circulation is important. This is this whole splenic circulation is important. And this portal vein circulation and draining direction, all parts. And then this portal vein again then drain into liver. Similar like right and left portal vein. This go into liver. Then finally drain into liver. Drain into liver. Then so this is the venous drainage of the stomach. Right gastric vein. Important veins are the right and left gastric epiploid and right and left gastric vein. Some esophageal branches and short gastric veins also important but not much. And this is the pre-pyloric vein of you. This is portal vein, left superior mesenteric and inferior mesenteric, and then splenic vein. Then So this is venous drainage. Now come to the lymphatic drainage of the stomach. Lymphatic drainage. So again, we form a stomach. There are some lymphatic nodes which is present near the stomach, and then these drain into finally the thoracic duct and cisterna basically. So we have to collect the vein, collect the lymph from the stomach region, and then drain into the thoracic duct cisterna region. So first, there are lymphatic drainage lymph nodes. The most important lymph node is celiac node. Celiac lymph node is celiac trunk. This is most important. All drain into this. Then here is lymphatic node 1 and 2. One lymphatic node here and one lymphatic node here. This is pyloric region. So these nodes are called, this is below pylorus. So these are called subpylorus, pyloric node. Pyloric lymph node. And these are the above pyloric region. So these are called suprapyloric. Pyloric node. Then here is important lymph node. Another, these are called right gastric lymph node. Right gastric lymph node. Done. And another is this, the left side. So again, here is a lymph node called gastro hip, right gastropancreatic, pancreatoduodenal, pancreatoduodenal lymph node. Then pancreatoduodenal basically. Right and left basically we can also see. Then these are the right and left. So these are the some lymphatic nodes. And another is epiploic lymph node. Another is one important node we can also draw. Then these are the right, left. These are the right pancreatoduodenal. Duodenal node. So these are the some nodes. So how the limbs flow from one duct to another duct. We will cover this. So direction of lymph flow is like this. All lymph nodes indirectly or directly drain into the celiac lymph node. Here is one important another node also present here, which is called hepatic node. Hepatic lymph node. All directly or indirectly drain into the celiac node. So direction of arrow is like this. This drain into the celiac lymph node. Here also drain into the celiac lymph node. This also the lymph node of subpyloric first drain into the suprapyloric and then these drain into this. For these, they first drain into from into this and direct and can also directly into celiac lymph node. Both are correct. Then another is these also drain into celiac lymph node, but from back side. Done. So this is the direction of lymph. Here is celiac lymph trunk. Now from where celiac trunk? This lymph go into the bag-like structure called cisterna chyli. Cisterna chyli, and then go into the thoracic duct. This is called thoracic duct. Thoracic duct, and then this drain into the subclavian vein. Subclavian vein junction basically go into the subclavian junction. Basically left side junction of subclavian vein. So this is the pattern of lymph node direction. We can write here junction of subclavian and internal jugular. Internal jugular vein. Junction of subclavian and internal jugular vein. This is the whole direction of lymph flow, lymph drainage of the stomach. Pancreatic, right and left pancreatoduodenal lymph node, hepatic lymph node. This side celiac lymph node. This is important celiac node. Celiac trunk भी बोल देते हैं इसे celiac node. This is the important terminal. From here, lymph drain into the sternocali, then thoracic duct, and then junction of the subclavian and internal jugular vein finally, and then goes to the heart. This is the direction of lymph flow, lymph drainage of the stomach. Then come to the nerve supply of the stomach. Then these are the three things: arterial supply, venous drainage, and the lymphatic drainage. Arterial supply whole. We have covered this. Then this is the whole things we have covered. Arterial supply, venous drainage, and then lymphatic drainage. Now cover the blood supply. blood supply, sorry, lymph nerve supply of the stomach. So nerve supply of stomach. So there are two types of nerve supply. One is sympathetic and parasympathetic. Sympathetic come from which? This is T5 to T12 around. Sometimes T7 also include T7 from T7, but this is the main point. T5 to T12 sympathetic supply, and parasympathetic is from vagus, basically vagus nerve. We know vagus nerve are two. One is left and another is right. So in abdomen region, this vagus nerve turns, rotate, and then left becomes the anterior and the right becomes the posterior. This vagus nerve was first in thoracic region, we know left and right. Now it turns and the left comes in the front and the right goes in the behind. So it is called in stomach region, basically abdomen. This is anterior vagal trunk, and this is the posterior vagal trunk. Done. So how this supply? First, again we draw the small stomach region for left side and right side, basically anterior posterior. Then first this is anterior trunk, vagal. Remember, this is anterior vagal trunk. Then we draw the posterior. So here we use this. From above, this is the vagus nerve. Then it divides and gives the many branches. First, it gives the important nerve which cover the lesser curvature of the stomach, then and cover the anterior side. It gives another branch, gastric, then one another branch. There are three branches. This is gastric branch. This is celiac branch, and this is the anterior nerve of Letarget. This is all called nerve of Letarget. Anterior nerve of Letarget. That this is the anterior nerve trunk of Letarget. Some fundus branches also give. This is the anterior, and the posterior is also similar. Posterior में just one important also come. Now this is the posterior. One is similar, celiac branch. Another is from in posterior side, nerve of Letarget, posterior nerve of Letarget, and one is gastric branches, and one important nerve is which is called criminal nerve of Gracie. First, this is celiac branch. This is posterior nerve of Lethargic. Gastric. All are posterior branches. These are anterior, these are posterior. Gastric branch. And this is the important nerve, which is also have clinical importance. Criminal nerve of Gracie, which is in fundus region. This is the important in surgical time. This is the most common nerve which is spared during vagotomy or during stomach surgery. This is the most common nerve which is missed. So it is clinical. So here is clinical point. Gastric branch. But clinical during stomach surgery. Stomach surgery. This nerve can be missed. This nerve can be missed. So we should aware from this. The cranial nerve of Gracie. This anterior and this is posterior vagal trunk. This is posterior, right or posterior. The this is anterior. So this is the nerve supply of the stomach. Now some clinical aspect or also clinical in some in acidity condition, high acidic condition, ulcer condition, in ulcer condition, ulcer and acidity problems. We do vagotomy, highly selective vagot, sometimes highly selective vagotomy or normal vagotomy, in which we cut the some nerve supply vagus branches which supply the fundus region or basically gastric glands. Vagotomy or highly selective vagotomy. Selective vagotomy. इसमें क्या करते हैं? We cut either whole trunk, either anterior or posterior trunk, in which we cut whole trunk, and this in which we only cut some branches, in which we only cut branches, some branches, basically fundus region branches, some branches, basically fundus branches. Fundus branches, etc. Then, so this is the clinical point. One is criminal nervography, and second is this first. Second is nervography. Basically, first, second, we can say anything. Second is nervography of Gracie. The third point is stomach obstetric bariatric surgeries. Third is bariatric surgeries. This occur in this is done in is done in obese patients. How? There are two types. First is malabsorptive absorptive, in which we bypass the stomach and directly drain stomach content into the duodenal region. Basically, bypass the stomach. Bypass the stomach. Because we reduce the fat in the obese patients. How? By bypassing the stomach, in which we reduce the work of stomach. Bypass कर देते हैं stomach food को directly esophagus to duodenum, like this. Let's say esophagus के through food आया, we cut this part. This is the stomach, and this again duodenum continue. This is cut. This now join with this. So this is the malabsorptive. Then this is the pattern of malabsorptive bariatric surgery. And another point is predominantly mentally restrictive surgery. In this, in which we stitch the some stomach region. Basically, let's say this is the stomach, this is the whole stomach. We stitch the stomach like this. Stitching कर देंगे. We done stitching. So food not go into the big this region, in this region. Directly food come and pass like this. This region is stitched. Stitching is done. Stitching is done. Done. So this is the stomach. Stomach clinical aspect. So their nerve supply, arterial, venous, lymphatic drainage, their histology, all aspects are covered. One important point also take at stomach surface. Stomach surfaces. So it has two surfaces. One is it is not complete like anterior and posterior surface. It has two surfaces. One is anterior superior, just like it is slightly tilted. So one is anterior superior and another is posterior inferior. Inferior. So stomach is like this, slightly tilted. Let's say this is the stomach, so it is tilted. This is the anterior superior surface, anterior superior, and posterior inferior. Inferior. That these are the two surfaces of stomach. Then these are the whole data covered oblique things. Now last we cover the relations. This is the data of the previous class, previous part. The last is region, stomach, anterior and posterior relations. Relations. So first, in posteriorly, we know whole is stomach bed, whole stomach bed. Posterior, posterior we can write stomach bed. It includes a pancreas, body, pancreas basically, splenic, artery, lesser sac, spleen. All these are the stomach bed parts. And the anterior is anterior relations. Stomach bed we have already covered. Stomach. And some celiac branches also come, celiac trunk also come into the posterior relations. And one important one, left kidney, and left suprarenal gland. Left suprarenal gland. Then anteriorly is completely anterior wall, anterior abdominal wall. Abdominal, anterior abdominal wall and layers, wall and muscles. basically rectus abdominis, transverse abdominis, internal oblique, external oblique, all these are muscles of the stomach, and skin, superficial fascia, deep fascia, superficial fascia. These are, and ribs also. Basically, rib not come, not much, but these are the important points. Muscles, anterior abdominal wall and muscles. We can write superiorly and inferiorly also. So first talk about the inferior. Inferiorly, we know the transverse colon also come, transverse colon also come in the this inferior relation, and also pancreas. Basically pancreas, not because pancreas also include here, but pancreas also slightly come because pancreas are present posterior inferiorly. So we can also write here, but not right. True. But and superior pancreas लिख सकते हैं, posterior राइट कर देंगे, लिख देंगे बस नीचे posterior inferior, posterior inferior. but superior में not much, superior में just write diaphragm. Diaphragm is in superior relations of the stomach. So basically these are the relations of stomach. Done. For better understanding, we can draw this diagram of the stomach bed. Let's say this is the vertebra. This is the 12th vertebra, T12. Done. And here is the kidney. This is in the posterior wall. This is the right side, remember. This is, we can write, this is left. Let's say this is left and this is right. Done. This is the right. So here is, if this is left, this is aorta, abdominal aorta, and this is vena cava. Done. Then abdominal wall also come. This is the abdominal wall, abdomen basically, but this is the peritoneum. We draw the peritoneum on another. Inside we draw peritoneum. This is the peritoneum. Here is right kidney. Here is pancreas present. This is pancreas. Because we know pancreas is retroperitoneal, except its tail. Whole pancreas is retroperitoneal. That this is the important point about the pancreas. Its tail is intraperitoneal, but whole pancreas is retroperitoneal. And behind this, the lesser sac. This hole is the lesser sac. Done. And here is our important organ, which is the most important, stomach. This is the region where the stomach present. So first we label it stomach, lesser sac, pancreas, left and right kidneys, left kidney and right kidney, all. Abdominal aorta, aorta. We can also draw here is splenic vein and splenic artery. This darkish, which is behind the pancreas. This is the splenic vein. Splenic vein. This is the vena cava. These are also come in the posterior bed, stomach bed. Vena cava, IVC basically, inferior vena cava. Then and above, we can also draw the. This is the splenic artery. This is splenic artery. Artery. Then then this is the lesser sac, and this is the pancreas. Above it, this pancreas, and above it, or right lithium, lesser sac, or celiac trunk, splenic artery, splenic vein, and here is suprarenal gland, renal gland also. Done. So this is our stomach bed complete. This is area is stomach bed. We can write above abdominal aorta also here. Abdominal aorta. All things behind the stomach are called in stomach bed. This is the stomach bed. Stomach bed. Basically posterior relations of stomach. Posterior stomach relation. Stomach relation. Relation. Done. So this is the stomach bed. This. Note this. This is the peritoneum. Peritoneum. Well, this peritoneum, all things, this abdominal aorta, vena cava, 12 thoracic vertebra, kidney, suprarenal, all are these are the retroperitoneal. Pancreas is also retroperitoneal except the tail. Then this important section, remember, this is lesser sac. It is a blind space between the peritoneum folds, anterior and posterior basically, and stomach is completely inside. The stomach is covered by anterior layer and the posterior layer. Then, so this peritoneum. So whole our stomach is complete. So this is our complete stomach. This this is the complete stomach. All things we can take recap from the in starting. This is the stomach oblique layer, horizontal layer, position left cardiac and is 2.5 centimeter left to mid sternal fifth costal space fundus. This is seven. Wait. This is seven. Seven. Sorry. This is the seven, and this fundus is the fifth. Fundus is fifth. Sphincter also present, but false. Cardiac end is false sphincter, and another is anatomical sphincter, which is the pyloric region sphincter, which is the true sphincter. In front of the pyloric sphincter, there is a vein which is called the peripyloric vein of you. We have drawn previously in venous system. This is the prepyloric vein of mu. This is prepyloric vein of mu, which is in front of this, which is front in front. That this is front. Just clean it. Then seventh. Remember, this is seventh. By mistake, true sphincter, anatomical sphincter, and gastric canal is very thin because oblique layer is not present. This is the histology of the stomach. Serosa. In stomach region, it is called serosa, and sometimes like this, which is part in thoracic region, like esophagus. It is mostly in adventitia region. It is also this